Molly, fast forward 2 to 3 years from now, I've invented a widget. I want to snap it into the ecosystem. Do I call 1-800-Molly? Do I get on my mobile phone and hit a button and poof, it's there? What do we look like 2 to 3 years from now?
That's some exciting technology. I like that. So a few of the folks already have talked about some really exciting things that we hope to see in 2 to 3 years. So Kim talked about electronic prior authorization, really removing the burden, removing the wait time. So that's definitely in our future, 2 to 3 years. I really hope that we're smoothing that process out, that the burden for the providers and for the support staff who are doing all of the paperwork now, that they're not faxing and they're not filling out the same forms over and over again, but instead that information is being pulled out of the medical record, being automatically sent, really taking advantage of those Fire APIs and the really great work that HL7 Da Vinci has done to make that more seamless for both the, all ends, the patient, the provider, the payer. And Catherine, you mentioned a lot about, really putting the information in the hands of the patient and making sure that the patient has some autonomy to make decisions. And so there's been a huge focus both at ONC and at CMS with the health tech ecosystem of making sure that patients are kind of the main provider of that information, that they have access to it, that it's on their phone, that it can travel with them. I really like the future Kim talked about too of saying like, they can carry it around with them instead of it needing to arrive, at the provider's office. And so making sure that our some of our technology that is already in existence, like our G10 APIs and certified health IT systems, and that those APIs are being used for patient apps and for making sure that the patient really has control of that data, where it's sent, when it's sent, how they access it. So I also think that in a few years, we'll be thinking less about how is our data being sent and is the right data being sent? Is that data of high quality? Are the folks who are receiving it able to use it? So I think we'll be able to move a bit more from is it getting to where it needs to be and is the right data and is high quality data being where it needs to be?